Hi, welcome to today's video. I'm uh, I'm running a group in November for knee arthritis people, and it's over 6 weeks. So I want to go into a little bit of detail about that at the end of the video, but I did want to give you a couple of things that you can try in the meantime, which will help you just see if this knee program is a right fit for you. If you are someone that just wants to be a bit more proactive about understanding your knee arthritis and want a bit more confidence about knowing what to do, then this is for you. But if you want a little bit more of a passive quick fix, then not necessarily for you. Yeah. My background is that I've got 18 years or so experience as a physio. However, a couple of years ago, I was experiencing some pain in my finger. So I went to get it investigated, and I sat down in front of the GP. They were like a couple of years qualified into being a GP. So they're fairly new. So I was, thinking they would have the up-to-date information on, research and what's being said. And I sat down and they told me that I had wear and tear in my finger. Now, that's quite disheartening, especially as a physio. I know that that's outdated, thoughts, because how can I wear out one of my joints without wearing out all of them? So, that it just doesn't make any sense with that wear and tear terminology. So it just got me kind of thinking if I, as a physio, know that, but also find it disheartening, how is it for anyone else that you've been told you've got arthritis and it's, wear and tear? And that's not now actually what the research is telling us. So yeah, that's kind of like prompted a lot of the videos that I've done on YouTube fairly recently, and that's why I want to run this program. So yeah. Uh, if you've ever been told that there's nothing you can do, that you have been given off, so that you've got arthritis, that is bone on bone, that is wear and tear, maybe it's just old age, then you are definitely not alone. I actually think the system doesn't give people the full picture, and that's what I'm here to help with, is to give you, yeah, that kind of greater understanding with that up-to-date information, really. Because I do truly think if you have that information and knowledge, it just helps you make those decisions, whether it's about movement, whether it's about whether you rest, whether it's even whether you go for surgery. So yeah, it's just that knowledge just helps things become a little bit clearer, I think. So before I go into the program that I'm running, there's just a couple of things that I wanted to kind of go through for you to try. So if you have seen any of my videos, you will hopefully be starting to realize that movement is really good. So movement actually nourishes those joints. So that's what the research is telling us. And the other thing to tell yourself and your body is that your knee is adaptable. So it changes with what you will do on a day-to-day basis. And your body is really strong, so can actually probably do more than you're thinking it should do. So, as an example, somebody has knee pain, and generally they come to me and they think that their pain is telling them that they've done some damage. But I want to challenge you to challenge yourself with this question. So, rather than thinking that pain is doing you damage, ask yourself, what's the pain telling me? So use it as information and curiosity rather than doom and gloom. So, as an example, we do know that arthritis is an inflammatory process. So, you have knee arthritis and you sit for a long time, that swelling will build up in the knee. And then when you move, the body's going to pick up on all of that swelling, and it's going to tell you by unfortunately giving you pain. And so then the pain is then telling you in that instance that you need to move the knee to help flush away that swelling. On the flip side, you can do too much, and that's with anybody can do too much, even if you've got arthritis or not. So you've done too much, maybe the day before you've done your normal walk, but then you've had to go and do an extra run to the groceries, maybe go and meet a friend, and then you wake up and you're like, my knee's sore. What's the pain telling me? In that instance, it's probably telling you did a bit too much the day before, and it's a really good idea just to kind of sit and rest. So use that pain as information, just to kind of, gently, question what's going on, so you can just start tuning into your knees, rather than, I suppose, being afraid of them. If you want to take that idea just a little bit further, you could go on what's known as context walking. So, the example would be you walk for 20 or 30 minutes and you find that your knee is sore. So, you walk around the block. The context walking would be you're doing the same walk, 20 or 30 minutes, but you're just going in different locations and doing different things. So, you could be walking on the grass or on the sand or walking with a friend and enjoying a chat and the sunset. And so then in that instance you're just monitoring that knee pain. Does it change? Do you find that when you're walking with your friends, that maybe you're not getting as much pain as when you're just walking around the block and mulling over things that are going on? So yeah, it's a good idea just to kind of test out what that knee does in the different situations, and you just start paying attention to what the knee is saying, and so that starts to give you that information, so you can learn how movement, mood, and attention, they all interact, and change things, and can give you the confidence just to make decisions on a day-to-day basis. So then that's why I've created the 6 week program. It is really small and personal. I've designed it so that you can take back a little bit of control. And so we'll work twice a week as a group. You do get individual appointments at the beginning and the end of the program. And so that's just to dive a little bit deeper for you, just to figure out where you are, and what's the best plan for you going forwards. And then the twice weekly meetups will be Q&A. We'll go through the current research, so I'll let you know what that's saying, and then we can go through exercises as well. So definitely for you, if you are stuck between knowing something needs to change, and not really knowing where to start. If you've been told that your knee is just age and there's nothing you can do, then there's definitely something you can do. And certainly it's for you if you want to be proactive rather than passive, and just kind of figure out, how to move and start to feel confident again. So it is the first time I'm running this as a live group. I am keeping it small. It is a maximum of 6 people, just so that everyone feels supported and heard. So you would be a founding member. If you've got any concerns, you're thinking you might be too old or too sore, we do go uh, we do kind of we go at your pace, really, and I just think you don't need to be fit, you just need to be curious and open-minded about what the current research is saying, really. If you've tried physio before and you didn't think it helped, challenge yourself, or maybe kind of reflect back. What did they do? Did they just look specifically at the knee, and maybe just do some hands-on work with you? Or did they cover other things, and start to explain things like stress will increase pain, and lack of sleep will increase pain? So just a couple of things that are outside the knee joint itself. There's all these things that go into giving you that pain experience, and so is good to address, and it's whether your healthcare professional in the past has kind of covered all of the different areas, or just perhaps focused on one. So yeah, that's what we'll go through. So if it's something that that you've been looking for, then I'll put the link in the description below. Just takes you to the information page. You can sign up there, or send me an email if you've got any questions. I will reply. Thank you very much for watching, and I will see you soon.